16 Reproductive System Health.
For the chapter 16 is we have the reproductive system health. So here we have the different effects of aging on the reproductive system. First is that hormonal changes cause the vulva to atrophy. There's also flattening of the labia and loss of subcutaneous fat and hair. Next is the vaginal epithelium becomes thin and the vaginal environment is drier and more alkaline. The uterus and ovaries also decreases in size, and the fluid ejaculated usually remains the same, although it contains lesser amount of the living sperm. Testosterone stays the same or decreases only slightly. And then last is most older men experience an enlargement of the prostate gland as some of the prostate tissue is replaced with the fibrotic tissue. Now let's proceed with the reproductive system health promotion. So here, an annual gynecologic examination including a pap smear is essential for every older woman. She should also be knowledgeable about self-examination of the breast. And men with prostatic hypertrophy should be examined at least every 6 months to ensure that a malignancy has not developed. Now we have to take note here that it is only recommended for a patient with a history of prostate cancer. Now let's proceed with the assessment. So for the assessment, we can do an interview. Like for pain, we can ask here if the patient experienced any pain in the lower abdomen or anywhere else. Is there any tenderness, discomfort, itching, or pain anywhere along your genital area? And last, if do you experience any pain during sexual intercourse? And then for the discharge, we can also ask if do you have any secretions, blood, or other discharge from your genitals. We also have nursing diagnosis associated with the health problems. For example, if the cause is vaginitis, the possible nursing diagnosis is impaired skin integrity. Next, if prostatic enlargement, the possible nursing diagnosis is impaired urinary elimination and acute pain.
So hi everyone, I will be discussing the selected reproductive system conditions. So first is the problem of the female reproductive system. First is infections and tumors of the vulva, vaginitis, cancer of the vagina, problems of the cervix. We have two types, cancer of the cervix and cancer of endometrium. So we also have here the cancer of the ovaries, perineal or herniation, dyspareunia, and cancer of the breast. So next is we have here the problems of the male reproductive system. So we have here the erectile dysfunction, benign prostatic hyperplasia, cancer of the prostate, and tumors of the penis, testes, and scrotum. Now, I will be discussing first the female reproductive system problems. So, we have here first the infections and tumors of the vulva, which is in age-related changes. It makes the vulva more fragile and prone to irritation and infections. So, serious underlying conditions like diabetes, hepatitis, leukemia, and pernicious anemia may present with vulval symptoms. So, senile vulvitis is used to describe the term of vulvar infection, which is the pruritus or the itching is the primary symptoms, also restlessness, scratching. For the treatment, we also encourage the patient to have a proper hygiene, nutrition, sitz baths, and steroid creams. So, we can also remember that vulvar cancer is the fourth most common gynecologic cancer in older women. Yung common site is clitoris, symptoms, painful, foul-smelling tumors. For the treatment, we have here the radical vulvectomy, and also for the nursing care, we support body image, sexual health, and early detection. For the next female problem, we have here the vaginitis. So, the postmenopausal changes can decrease the collagen and the fat. It shortened or narrowed and less elastic vaginal canal. Fewer secretions and more alkaline pH due to low estrogen. And also, it can increase the fragility, raises the risk for vaginitis. For the symptoms of it could be itching, burning, discharge, and bleeding. For the treatment, we have here the local estrogen, zinc, boric acid, and gentian violet. For the nursing care, we can advise the patient to avoid douching and use perfume products or yung may mga scent na products like soap, ganon. And then we can recommend to use cotton underwear, use lubricants, and to have a proper hygiene.
Vaginal cancer is rare and usually affects older women, often due to the spread from nearby cancers. If ulcers or masses are found, especially in older women, a biopsy is necessary. Chronic irritation like from vaginitis or long-term pessary use increases risk. That's why regular pap smears are essential. Treatment options include radiation, chemotherapy, or surgery. To remember the risk factors, think VAG check. Endometrial cancer is more common in older women. Risk factors include obesity, late menopause, infertility, PCOS, and unopposed estrogen therapy. The biggest red flag is postmenopausal bleeding. It's diagnosed through dilatation and curettage and treated with surgery or radiation. Polyps can also be an early warning sign. Here's an easy way to remember the risks. Old bleed. As women age, the cervix may shrink and glands might seal up, forming Nabatean cysts. These cysts can cause fever and tenderness. Regular gynecologic exams are important to keep the cervix healthy and detect problems early. Cervical cancer is often diagnosed around age 49, but older women have a higher death rate. Early symptoms include vaginal bleeding and leukorrhea, while pain is uncommon. Late-stage disease may affect urination and bowel movements. Treatment options are surgery or radium. Women over 65 with a normal screening history can stop routine pap smears. To help remember key points, cervix bleed. Though ovarian cancer only makes up 5% of malignant diseases in older women, it is the deadliest gynecologic cancer. Early symptoms are vague like GI discomfort, which makes it harder to catch. Later signs include vaginal bleeding, ascites, and abdominal masses. Treatment usually involves surgery or radiation. Even benign-looking tumors must be removed to rule out cancer. To quickly recall the symptoms, bad mass. This condition is common in older women, especially after childbirth and with aging muscles. Symptoms include pelvic pressure, back pain, incontinence, constipation, and even painful intercourse. Surgical repair is the main treatment. To help you remember, press in.
Now let's proceed to dyspareunia. So dyspareunia is the pain experienced during and after sex. So this condition is common in older women or nulliparous women who are not given a chance to conceive a child. So if a woman has this kind of condition, they are recommended to undergo gynecological examination. Next is breast cancer. So breast cancer is known as the second leading cause of death in older women. So what happens here is that we have a decreased fat tissue or degeneration of the cells in women's breasts. So if you have this kind of condition, it is recommended to have breast examination or mammogram at the age of 40 and 75 with an interval of 2 to 3 years. Now we are going to discuss the male reproductive system. So first is we have the erectile dysfunction. So erectile dysfunction is the inability to sustain or achieve erection during intercourse. Commonly, it is experienced by men older than 70 years old. So some lifestyle or conditions that lead to this condition are hypertension, diabetes, alcoholism. There are also medications that can lead to these, which are the SADAT. We have the sedatives, anticholinergics, digoxin, depressant or antidepressant, antihypertensive, and lastly is tranquilizer. Second, we have benign prostatic hyperplasia. So, benign prostatic hyperplasia happens in older men. So, according to some statistics, 1 in 4 men with this condition have dysuria. So, this condition progresses slowly but continuously. But to intervene or for us to manage this, we have the POS-T. So, you can read on your screen what is POS-T.
Next, we have prostate cancer. So for the prostate cancer, we have the BADMAP. So B stands for benign hypertrophy needs monitoring because it can possibly be connected to prostate cancer. A, asymptomatic in early ages or stages. D is for digital rectal exam is needed. Next is M. We have the men over 70 years old. So just like the erectile dysfunction, this age group is affected. A is for assisted by PSA test and confirmed through biopsy. And lastly, P, prostatectomy, irradiation or exposure to radiation, and as well as monitoring are the treatment or intervention offered here.
For the nursing care plan, we have different possible nursing diagnoses for this one. And here we have is one of the example, is for injury and infection related to surgery. And we have the goal is the patient is free from injury and free from infection. For the nursing management or nursing action, advise the patient to avoid strenuous activity for 3 to 4 weeks. Advise the patient to avoid constipation and volcanic fever and encourage high fluid intake unless contraindicated. Tumors of the penis, testes, and scrotum. Cancer of the penis is a painless lesion or wart that grows in the prepuce of glands. To check this, we are going to do the biopsy. Next is the testicular tumors. It is uncommon in older people. However, if it occurs, it can be malignant. And we are going to do the chemotherapy, irradiation, and orchiectomy to check if there is a presence of tumors in the testes. Next is the scrotal masses. It is usually benign and can result from the conditions such as the hydrocele, hernia, and varicocele.
Chapter 17 Mobility.
Next, let's proceed with chapter 17, which is about mobility. So here we have the different effects of aging in the musculoskeletal function. So the decline in the number and size of muscle fibers and subsequent reduction of muscle mass decreases the body strength, and grip strength endurance also declines. For the musculoskeletal health promotion, educating and encouraging persons of all ages to exercise regularly is an important way that gerontologic nurses can influence the health of today's and future generations of older people. So we have exercise program that should address the following. So first is the cardiovascular endurance. So depending on the exercise, this should be done for at least 20 minutes, at least 3 days a week. And then for the flexibility, stretching exercise for about 5 to 10 minutes before and after other exercises can reduce muscle soreness. For the strength training, the recommendation for most adults is to exercise a muscle through a set of 8 to 10 repetitions at least twice weekly. So here we also have different nursing diagnoses for aging risk to maintaining an active state. So for decreased cardiac output, we have activity intolerance related to less efficient management of stress. For brittleness of bones, we have a nursing diagnosis of risk for injury. We also have exercise program tailored for our older adults. So exercise can improve body tone, circulation, appetite, digestion, elimination, respiration, immunity, sleep, and self-concept. Some older individuals may be unable to participate in formal exercise program. So for this person, we can suggest that the patient do foot, leg, shoulder, and arm circling while watching a television. So we also have one of the guidelines for exercise program for our older adults. First is assess the older adults' current activity levels such as the range of motion, muscle strength, and tone, and also response to their physical activity. And last is emphasize the exercises that focus on good speed and rhythm.
For the next topic is now I'm going to discuss the mind-body connection. So as we age, of course, the mental states affect physical activity. So inactivity results to poor circulation, fatigue, low endorphins, worse mental health. So activity improves mood and cognition. So as nurses, we help to tailor activity plans for patients with mood or cognitive issues. We encourage their hobbies like arts, music, dancing, gardening, and more. So older adults benefit from exploring new interests. Here are the preventions of inactivity. So inactivity leads to deconditioning, which is worsened sarcopenia. So for the barriers, we have here the fatigue, pain, dizziness, dyspnea, chronic illnesses. So the family may unintentionally promote sedentary behavior. So the activity supports muscle, heart, and brain health. So the benefits of staying active is to lower blood pressure, maintain strength, prevent falls, aid circulation, boost mood and cognition, and improves digestion or elimination. Also, we can encourage the daily activity of our patient to have to boost their motivations. And of course, we have here the role in promoting their activity, and for their nutrition, they have at least 1,500 milligram of calcium per daily. Here are some exercises to do while in bed. The first one is flexing the knee with the opposite hand holding the foot for assistance. Next is scissor-like crossing of the legs. And bicycling. And here are some exercises to do while sitting. The first one is circling motion of the shoulder joint with the arm at the side. The next is circling of the arms. And lastly, rotating the head. So now, here are the deleterious effects of inactivity. So we also have here first the changes in physiologic function. Of course, as we age, there is changes in physiologic function like reduced pulse rate, increased cardiac workload, decreased aerobic capacity, reduced muscle strength, tone, and endurance. And next is, as we age, of course, there is increased risk of complications, especially in older adults like postural hypotension, hypostatic pneumonia, pressure ulcers, poor appetite, obesity, constipation, urinary tract infection, joint stiffness, limited range of motion. Of course, as people age, there is changes in mood and self-concept. Of course, there is increased feelings of helplessness, depression, and also perception of self as incapable and frail. Also, there is an increase of dependency and reduced opportunities for socialization. Next is, I'm going to discuss the gait disturbances. So first is ataxic gait. So it looks like unsteady, feet lifted high and then slammed down. It's seen in cerebellar disease and alcohol intoxication. So next is foot slapping gait. So it looks like feet slap the floor, no swaying or balance issues. It's seen in nerve damage, the lower motor neuron disease. Next is hemiplegic gait. So it looks like one leg stiff, swings in a circle, arm on, same side flex. It's seen in stroke or upper motor neuron damage. So we have here the picture so you can see what it looks like. So now, here are the deleterious effects of inactivity. So we also have here first the changes in physiologic function. Of course, as we age, there is changes in physiologic function like reduced pulse rate, increased cardiac workload, decreased aerobic capacity, reduced muscle strength, tone, and endurance. And next is, as we age, of course, there is increased risk of complications, especially in older adults like postural hypotension, hypostatic pneumonia, pressure ulcers, poor appetite, obesity, constipation, urinary tract infection, joint stiffness, limited range of motion. Of course, as people age, there is changes in mood and self-concept. Of course, there is increased feelings of helplessness, depression, and also perception of self as incapable and frail. Also, there is an increase of dependency and reduced opportunities for socialization. Next is Parkinsonian gait. So it looks like bent forward, small shuffling steps, no arm swing, and it speed up gradually. It's seen in Parkinson's disease. Next is the scissors gait. So it looks like legs cross each other while walking, short steps. It's seen in cerebral palsy, dementia, and spastic paraplegia. Next is the spastic gait. So it looks like stiff, jerky steps, toes drag. And it's seen in spinal cord issues and spastic paraplegia. So next is the selected musculoskeletal condition. So musculoskeletal condition is common and often impair mobility, leading cause of disability in older adults. So the proper management is the key to preserving function and independency. So here are the conditions: the fractures, osteoarthritis, rheumatoid arthritis, osteoporosis, gout, podiatric conditions. So under the podiatric conditions, we have here the calluses, the corns, the bunions or yung hallux valgus. We also have here the hamertos or the GDTI flexus. We also have here the plantar fasciitis and infections, and also we have here the ingrown nails or the onychocryptosis.
Fractures in older adults are commonly caused by trauma, osteoporosis, bone cancer, or skeletal diseases. The most frequent sites include the femoral neck, especially in older women due to falls, the wrist, also known as Colles fracture, and the spine, where compression fractures occur from lifting or falling. Older adults are at higher risk because their bones are more brittle and healing is slower, increasing the chance of complications. Signs of fracture include pain, swelling, deformity, discoloration, and abnormal motion. If severe, the bone might even break through the skin. To prevent fractures, we advise older adults to rise slowly, use safe footwear, avoid risky movements, and install safety features like handrails, night lights, and clear walkways. In nursing care, always suspect a fracture after trauma. Immobilize the site, control bleeding, and monitor for complications like fluid imbalance, ulcers, and poor nutrition. Early mobilization with help is key to recovery. Osteoarthritis is the most common joint disorder in adults over 55, especially women. It's caused by wear and tear of cartilage with bone overgrowth, and unlike rheumatoid arthritis, it's non-inflammatory and doesn't lead to severe deformity. Risk factors include joint overuse, obesity, trauma, low vitamin D and C, and genetics. Commonly affected joints include the knees, hips, spine, and fingers. Patients often experience stiffness, pain during use or cold weather. Management includes acetaminophen as first-line pain relief, gentle exercises like Tai Chi and swimming, and using heat or cold. Assistive devices such as braces and canes help reduce joint strain. A diet rich in omega-3s, vitamins, and minerals, along with supplements, can support joint health. Nursing care focuses on pain relief and preserving mobility. We assess pain, apply heat, give medications as prescribed, and work with rehab teams to encourage safe movement and joint protection strategies. Our goal is for the patient to maintain function and minimize discomfort while avoiding complications like contractures.
Next, we have rheumatoid arthritis. So, rheumatoid arthritis happens at the age group of 20 to 40 years old. So, women are more at risk or individuals with family history. So, a major cause of arthritis disability is the RA. However, the incidence decreases when you reach the age 65 years old. So most patients develop this disease or condition at early stages of their life. So to describe, the affected joint is painful, stiff, swollen, red, and warm to touch. And it is painful even if you are at rest or doing activity. So for the symptoms, we have the fatigue, malaise, weakness, weight loss, fever, and anemia. So we have two interventions. You can read it also in your screen. Next, we have osteoporosis. So osteoporosis is the most prevalent metabolic disease of the bone. So this happens in the middle to latter day of our lives. The mineralization of the bone happens or occurs in this kind of condition. So osteoporosis can cause kyphosis or reduction in height. So any health problems connected with calcium, such as loss of calcium, excessive loss of calcium, can lead to osteoporosis. So, most commonly used in osteoporosis is the DEXA or dual energy X-ray absorptiometry. To proceed, we have our risk factors, which are the RISC-CHEF. So first is women greater than or equal 65 years old and men greater than or equal 80 years old. Ethnicity, of course, calcium deficiency, as I've said earlier, cigarette smoking, history of multiple pregnancies, estrogen deficiency, which makes the male more at risk at this condition. We have also family history of osteoporosis and female sex. Next, we have interventions called calcium BW. We have calcium-rich diet, avoid alcohol and quit smoking, low salt and caffeine, correct lifting, use of our body, improve posture with back exercises, and as well as use proper shoes, maintain regular exercise if needed also, balance training and falls prevention to prevent further injuries, and then walk daily to strengthen our bones. So now we have the gout. So gout is a metabolic disorder caused by excess of uric acid accumulation in our blood. So gout attacks long for weeks to months. So if you have gout, you can experience severe pain, tenderness, warm, redness, and swelling along the area. So for the interventions, we have the word gout, good fluid intake of alcohol, urine reduction diet, and therapeutic medication. Medication are the following.
Podiatric condition is a lifelong food problem that changes in gait and can cause disease that affect the feet. Pediatric condition. First, the calluses. It is caused by friction and irritation on the feet that create layers of the thickened skin. Next is the cord or the cone-shaped layers of thick, dry skin that form over a bony prominence. Bunions or the hallux valgus is a bony prominence over the first metatarsal head. Next is the hammer toe or the digitiflexus is the hyperextension of the metatarsophalangeal joint with flexion and often comes from formation of the proximal interphalangeal joint. Next is the plantar fasciitis. It is a common cause of heel pain. It is a thick ligamentation band in the bottom of the foot that runs from the ball of the foot of the heel. Next is the infection. We have two types, which is the onychomycosis. It is a fungal infection of the nail or the nail bed in which the toenail appears enlarged, thick, brittle, and black. Next, the tinea pedis is a fungal infection of the foot that can cause burning and itching. The skin surface will peel, crack, and be red. It is often with vesical eruption. Next is the ingrown nail. Is due to tight fitting shoes or cutting the nails in roll that can occur excessive short. Now, for the general nursing consideration for musculoskeletal condition, first is for managing the pain. Advise the patient to do the warm bath or apply a warm blanket, do the stretching and back rubs, and correct the positioning. For preventing injury, pay attention to the area and use railings and canes for support and use the proper fitting shoes.